The pandemic and troubling new numbers as this new coronavirus subvariant sweeps across the country. In fact, tonight here, take a look at the map. 85% of Americans are now living in areas where authorities are concerned about these numbers, where transmission rates are now medium or high. Areas in yellow, they're medium. Those in red, they're particularly concerned over high rates of transmission. Tonight here, what Dr. Jha is now saying about the current booster that's available and how much it could help if you get this new strain of the virus. Here's our chief national correspondent, Matt Gutman, now.
Tonight, with that highly infectious BA.5 subvariant spreading fast, the number of COVID-positive Americans in the hospital is once again climbing to its highest level since early March. But in L.A. County, doctors at Providence Cedars-Sinai say, unlike past surges, they're seeing fewer patients in respiratory failure.
We're seeing a lot more patients that have chronic illness in the elderly population. Seeing much less of people in their 30s, 40s, and 50s.
Still, experts say the numbers are steadily climbing.
It sort of feels like the public is deaf to the reality of this news. This BA.5 variant is hyper contagious, and right behind it, new variants are coming.
85% of Americans are now living in an elevated COVID risk area. More than half the population now in those orange high-risk counties where the CDC says you should be masking indoors. In those yellow medium-risk areas, they say consider masking based on your individual risk.
Masking where appropriate, vaccinating people who aren't vaccinating, and boosting people who are ready and eligible for their boost. We can do that, but we're not doing it to the extent that we should be doing it.
And more than half of eligible Americans still haven't gotten their first booster. But a new CDC analysis shows protection against initial Omicron variants increased with each booster shot, suggesting the current vaccine may still protect against serious illness from BA.5.
Very, very clear in my mind that your risk of ending up in the ICU is dramatically higher if you have not gotten a booster, if you've not gotten that third shot.
And David, Dr. Jha and the doctors here with a simple message to anyone over 50. If you have not had a COVID shot in 2022, get one and get it now. Dr. Jha saying it could save your life. It might not prevent you from contracting BA.5, but it drastically reduces the chances of being hospitalized and of dying. David?
Yeah, they're saying not to wait until the booster that's more directly associated with the subvariant this fall. Go ahead and get the boosters now. All right, Matt, that's an important point. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.